Hi, everybody. My name is Jaron Johnson. Today we're going to talk about social determinants of health. So what does this mean? Social determinants of health are conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. So with social determinants of health, there are four categories that influence our health and well-being. These categories are socioeconomic factors, physical environment, health behavior or lifestyle, and also healthcare. So going back up to the top, socioeconomic factors, is education, job status, family, social support, income, and community safety. Physical environment, this is pretty straightforward. This is where you live. If you're living in places of poverty, if you're living in places where of other extremely rich, two different sides. This can also influence your obviously influence your health in a positive or negative way. Health behaviors or lifestyle. This is pretty straightforward too. Do you drink? Do you smoke? Do you exercise? How is your diet? Are you having unprotected sex? Things like things like these. Things like this. Things like these, can affect your health and your well-being. And then healthcare, of course, this is a big one. Access to healthcare. Many Americans don't have access to healthcare, and this is definitely an influencer and an impactor on your health. We'll discuss this a little later on. So I thought this was an interesting visual to share with you guys. This kind of talks about each category and how big of an impact that has on our health in our well-being. So socioeconomic factors is the biggest one. It has a 40% effect or influence, I should say. This is again your education, your job status, family, social support, income, and community safety, as we just discussed in the last slide. And then physical environment. This is not so much. This only has a 10% effect or influence on our health. And then we have health behaviors such as tobacco use, your diet, exercise, alcohol, sexual activity, things like that. That has a bigger impact on our health, a 30% impact on our health, which would make sense. And then 20% is healthcare. So positive and negative sides of social determinants. So again, we have healthcare access, quality, education access, social and community context, economic stability, and neighborhood and environment. I'm going to talk about each one of these things. When I say positive and negative sides of social determinants, what I mean is that, for example, let's just say there's kind of two spectrums in society. There's a really rich and there's a really poor, and we have that middle ground, which is kind of lessening and lessening, right? It's kind of dwindling away. But my point is that if you're you're either kind of on those two sides. You have all your basic needs met because you can afford your food, you can afford your clothes and things like that, versus the negative side where you're on kind of the downside. You're living in poverty. You can barely afford your food and your water and clothes, your basic needs, and there's violence around you and drug usage and things like that. So each one of these I'm going to kind of talk about. Each one of these categories on the slide I'm going to talk about here next. So healthcare and access and quality. So about 1 in 10 people in the United States don't have access to health insurance. So I thought this was kind of pretty interesting. This could obviously have a negative impact on their health if they're in that kind of situation versus the positive side, like I was talking about. If you're on the higher side of society, this won't obviously affect you, but because most likely you'll have healthcare. But yeah, it's that's definitely interesting to think about. The next one I want to talk about is education access. So higher level of quality of education equals longer, healthier lives. This kind of makes sense because when you think about it, the more education you have, the better job you're most likely able to get, and that better job will most likely be paying you pretty well. And the more education you have, probably the higher income you'll probably earn, most likely. And so that will make your odds of getting food and and all your basic needs met, higher, and so that's interesting too. I thought it's kind of pretty straightforward, but it kind of makes sense. And in social and community context, this one kind of discusses, the relationships around you, the people around you. So if you have better relationships around you, it's going to equal better health and well-being. This is the idea. So for example, let's say that you don't have relationships around you. Let's say that you're going through hard times in your life, very hard times, and you don't have any social support or any social nets around you that you can go to talk to about these hard things. That can be very, very that can take a huge toll on your mental health and your physical health as well. Versus, let's say, if you have these great relationships and you have these people to support you in these hard times that you're going through in life. This is just the two extremes, the two opposites. But yeah, this can definitely have a positive or negative effect on your well-being and your health. And in economic stability, this one's interesting too. This is just in the United States. I found this little fact here. In the United States, 1 in 10 people live in poverty. So that kind of makes you think about some things. But economic stability is kind of just about do you have a steady job? I mean, are you in debt? How are you being able to afford the things you need to afford? And how is is your income? Things like that. Um, so if often if you have a steady job, that's going to lead to better health. You're going to have more structure in your life, which will lead to better health mentally and physically as well. And in your neighborhood environment, this is a pretty straightforward one too, and it's kind of a no-brainer. It makes sense too. Where you're living at can affect your health. The neighborhoods people live in have a major impact on their health and well-being. This is from Centers of Disease Control. So yeah, unsafe living situations are going to equal probably likelier to become more unhealthy, or vice versa, or opposite. If you're living in a great neighborhood, a safe neighborhood, then you're probably going to be more healthy. Um, so yeah, that's kind of interesting. And so to conclude, I just want to talk about how hospitals and healthcare systems can help um, educate people on these social determinants, and how we can help our populations become more healthier as a whole. Things we can do is we can engage with the community, we can gather data, develop organizational internal engagement strategies, explore funding options, and establish measurement strategies and evaluations. So going back up to the top, engaging with the community. This is pretty simple. This is holding a discussion with your community about the socioeconomic needs in your specific community, and then gathering that data from that discussion. Hospitals can gather data on how the social determinants of health are affecting that specific community or their specific community. And then you can develop organizational internal engagement strategies. Hospitals can develop internal engagement strategies to support um, support work around social determinants of health. For example, raising awareness about social determinants and sharing the benefits that may be anticipated. So basically, this one's just educating the population on social determinants, what they are, and how they can negatively impact you and positively impact you. Um, and then we have explore funding options. So hospitals can prioritize these efforts by integrating the social determinants of health programming into strategic and financial plans. And then lastly, we have established measurement strategies and evaluation. So this one talks about hospitals can explore various funding options and work with community partners to maximize the use of available funds, resources, and staff to the best of their communities. And here are my resources. But yes, overall, I thought this was a really interesting topic to learn about, and I hope you guys learned something through this presentation as well. And that's all I have for you. So thank you.